So why not just use stimulants? They work, don't they? So if you have a kid, you've made the diagnosis of ADHD, you've done it carefully. Well, actually, stimulants do work. About 70% of the time, in the short term, stimulants work. However, there are no long-term studies about the effects of a childhood of 5, 10, or 15 years of these medications on the developing brain. But what I can tell you that we do know is that it has to have an effect. The brain is constantly developing and making new neurons, new connections, your entire childhood right through adolescence. The neurotransmitters are like the bath, the culture in which the brain is developing. If you change those neurotransmitters, like you're doing with Ritalin or Adderall or Concerta, you are going to change how that brain develops. Now, maybe in some kids it's for the good. Maybe they'll develop a better frontal lobe. Maybe it's for the bad. I don't know. We don't know. I can tell you that in rat studies, if you take another drug, the SSRIs, the antidepressants like Prozac and Zoloft, if you give baby rats those medicines, those raise serotonin levels, when those rats grow up, they have lower serotonin levels. So what you've done is you've sort of decreased their ability to even make serotonin. So as an analogy, if that happened to human beings, they would have a higher tendency to depression than if they didn't take them. We don't have that kind of information about the psychostimulants. But you do know that it has to have an effect. You just don't know what it is. Here's some side effects, though, and you can read them yourself. Appetite, sleeping, abdominal pain. All these mostly go away if you take away the medication. A lot of people don't know that 1 to 2% of kids who get these medicines have hallucinations and psychotic-like symptoms. Usually they're seeing worms and crawly things. Very terrifying. That also goes away when you stop the medicine. But I sometimes wonder about the long-term effect of even having an episode like that. Yeah.